Department of Community Medicine and Family Medicine, and in year 2004 we were able to establish the Department of Family Medicine. There is a Department of Community and Family Medicine at Calais as a faculty of medicine. That's a combined department still. Now, in the other faculties, they have only programs in family medicine. In Colombo, they have an orientation lecture and a 2-week appointment with the general practitioner. At Perera, they have 2 lectures and 1 session with the general practitioner. At Rumuna, there are 3 sessions with general practitioners. Now, Colombo, Perera and Rumuna programs are incorporated with the community medicine programs. I don't know what happens in Jaffna.
There are no general practitioners here.
Now, just to talk about the family medicine program at Calais, they have a 2-week appointment in the 3rd year, 3 GP sessions in the community in the 4th year. They have 12 lectures, 2 tutorials and 1 session. Now that consists of their program, and the assessment is with the 3rd MBBS part. Out of the 100 marks they get for community medicine, 31% is given for family medicine. the general practice. Now, on these 6 days, they go to the community general practitioner. On 2 days, they sit in with us at the university family practice. Now, they also visit the outpatients department at Calcutta South Teaching Hospital to see how the state sector primary medical care is delivered. They see what kind of facilities are available, what type of a doctor-patient relationship is there, what kind of case mix is there, and they visit the outpatient clinics and come back and give us a report on all this. We have a discussion on what happens in the outpatient department. They are asked to pick up symptoms from patients who attend the university family practice center. I have a special presentation on the university family practice center which I can do later. So they pick up a symptom from the patient and they go and do a literature survey on each person has to pick up a symptom from a patient, do a literature survey and come and do a presentation to us. There we try to introduce them to a little bit of evidence-based medicine in general practice. But we also try to preserve the clinical assessment, the importance of the clinical assessment in patient care. They also have to go to the hospital ward, pick up a patient from the wards, our professorial units, and follow them up to their how to conduct a consultation in general practice. That is, student learns to take a history in the hospital inpatient ward, but they don't learn to consult with an ambulatory care patient. So this is done to make the student understand how to consult. They also visit an elder in the community and report back to us. These elders are selected by us and we visit them, and then subsequently the student goes and visits the elder and reports back to us. They also have to spend time at night in the OPD admission room and get involved in a discussion with us. We do get them to practice clinical skills from 8 to 9 o'clock in the morning when they come to us for their appointment. We also have a family attachment program or a social pediatrics program where the student is attached to a family for a period of a month during their pediatric professorial appointment. We also take part in this process. So you might wonder how we do all this during our curricular time. We have 4 meetings of professorial appointment. there was no way in which we could get marks for assessing the Tamil medicine work. So on the faculty it was, we were given 5 marks from pediatrics, 5 marks